Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Consistency of the sputum. The sputum can have three major consistency. The sputum can have serous consistency, mucoid consistency, and mucopurulent consistency. Serous consistency. Serous consistency states that the sputum is clear, watery, and frothy. So this serous consistency is seen in conditions like bronchoalveolar carcinoma, and it may also be seen in pink colored sputum is seen in pulmonary edema. Then mucoid consistency. Mucoid consistency states that the mucus is clear, grayish white or blackish in color, and it is also frothy and it is sticky to touch. The main important thing is the mucoid sputum production is always sticky to touch. So this mucoid sputum consistency is seen in conditions like chronic bronchitis and chronic asthma. Then third, mucopurulent or purulent consistency. In mucopurulent or purulent consistency, here this mainly occurs due to the pus which is present in the sputum. So this is seen in here yellowish or greenish brown sputum is seen, and this is mainly seen in bacterial infections.
thank you and thank you for watching.